Hi, my name is Shavon Wigfall, and I will be discussing my senior practicum course project, and it was on safety. Don't forget to run with a purpose. And as we all know, hospital safety is vital generally in respect to the overall health of a patient and the reduction of hospital-acquired diseases from experience. Such measures as hourly rounding, hand hygiene, and effective use of PPEs are very crucial in preventing the worsening of complications. So for my project, my mentor and I decided to focus on three main goals, and two was to improve in safety via structure rounding. And the first one was to increase the compliance rates for hand hygiene. We wanted to decrease the hospital inquiry on C. diff. We got two audits for C. diff in the past 2 months, and we wanted to see how we can improve on expressing our hand hygiene and and to bring that down. Um, the second one was proper PPE donning. We wanted to ensure the proper technique, so we wanted to achieve 100% adherence to correct PPE donning and doffing procedures. The third one was fall prevention. So we wanted to reduce the fall incidents, decreasing the numbers of falls on our units as well. So we are a PCU unit, and we do have a lot of confused dementia, patients that not very alert. So we wanted to help bring that down as well. All right. So the objective of this project was to review and increase the adherence to compliance mechanisms that are essential in the elevation of determination of patient safety. So we carried this out through patient safety audits. So the audits examine whether fall prevention interventions such as armbands used with yellow armbands and non-ski socks had been implemented. The use of hand washing and the correct use of PPE among staff members were also a vital area of evaluation as well. The second goal had the application of rounding that was structured as the second of them. We ensured that hourly rounding was carried out with nurses assessing fall hazards and education the patients, so that that if there was alert in it, we gave them the education that they needed. So if they comply with the directions of safety, we gave them the option of letting them choose to have the bed alarm on, and if they didn't, we also documented that that they didn't want to have the bed alarm on, and we gave them that option. So the third goal was also to enhance adherence with PPE and hand washing procedures. We did training sessions that were provided and teaching staff how to down and off correctly, and use the PPE in a bid to minimize the spread of infection. The adherence audits indicated that the training evaluated staff and the sanitation as well. Due to realization of the fermentation goals, we were able to prioritize patient safety within the daily nurse practice. So we had to implement all these things by coming up with realizations for project goals. So we adopted a few strategies, and the first strategy adopted was fall prevention. So falls in the hospital are a major issue, and numerous patients are at risk. So we made a point of ensuring that any patient identified with a fall risk had fall intervention automatically in place. Um, we made a point of ensuring that any patient identified with a fall risk, we entitled ensuring that the bed alarm was automatically turned on, plugged in. We also made sure that nurses made sure that the patients had yellow armbands on, non-ski socks, made sure that it was visual to the nurses and also to the patient care techs. And they made sure that it was a reminder to set the bed alarm on. We also made signs as well. We Patient education also came in handy with this. We asked the patient if they knew fall prevention strategies and how they could take an active part in it, and also to be safer. So we also involved patients as well, so that was good. The second intervention was the enhancement of hand hygiene inherence. Sorry. Hand washing is the simplest and yet the most powerful intervention against, infections. So yet the adherence of many of the healthcare workers, it has been a problem. So me and my mentor, we decided to follow some of the nurses with rounding to see if the nurses was actually washing their hands when entering and exiting the rooms. And we found that some of them were forgetting to wash their hands when entering, and some of them was forgetting to wash their hands when exiting the rooms. So we in training we addressed the usual about barriers, limiting time and forgetfulness. So through the intervention, I said 90% of the staff members had better adherence after we did our training and we implemented the infection, rates, and the we implemented the hand hygiene. And the third strategy focused on the use of PPE. The staff members went through practical training and quizzes to reinforce Don and endorphin procedures correctly. This avoided cross-contamination, and the results showed a positive feedback after the changes in compliances and made the unit safer for staff and patients. I would say that on once I had gave a knowledge test, like on the right use of PPE down in, participants were asked to to one specific question that we did. Me and my mentor did point it out that we had that some of the nurses did had like kind of mixed emotions on it was the correct use of when what to take off last on the on down in um the PPE, and everyone kept saying to take off your eye protection last, and the right answer was to take off your gloves. So we had to implement on that part of the material education the most, that you take off your gloves last. So, we had to educate on that more so so we could minimize the spread of infections. But overall, to measure the project success, we assess the staff adherence and knowledge retention, and the results show a dramatic improvement. So, rounding adherence had been uneven prior to the project. So, following the training and audits, 95% of the staff attested that they followed the rounding process more effectively now. And this translated into frequent checks of patients and the use of rounding process were more effectively. So we're happy for that. And the fall prevention, however, it was much more needed. So we're happy for the outcome. The influence on infection control, approximately 91% of employees showed an improvement in the use of hand hygiene and the use of PPE, proper PPE down, and so we are very happy for that. This is crucial because good hand hygiene prevents hospital-acquired infections, and so we're trying to keep that C. diff number down. And employees showed an improvement in the confidence they had in infection control procedures after the training, so we are very happy for that as well. However, there were some challenges. The small sample size limit the ability to generalize findings. So I wish we had like a little more study, like a larger study group. I think would have been more understanding compliance trends. And also documentation. I wish that we could have used the electronic system instead of my paper-based, because it made it a little hard to keep track with collection data, because not all the nurses like fill out remember to fill out the audits, because some of them forgot to returned it back in. Some of them took it home. And then it was a little misunderstanding. So we had to go back and try to get all the audit papers back and try to redo all the paperwork over. Um, I would say that for future recommendation, the study be further developed with additional staff and technology uses in the future for further observation. And also, I wish we could have had like more data for patient fall and infection data to make it more available to measure like after the education intervention to see what we could have done or and see like what was the number prior to it to see how big it was and the impactment on the unit. So that would have been nice. But overall, this project will have I think it will have a lasting impact on our nursing unit. Through running improvements of compliances, we established patient safety and interventions as a standard of frequent occurrences. So the staff has gotten more actively involved in infection prevention. So that was good. And beyond the acute care environment, this project I think will be good for education, informatics, and formative of in policy. This project has the potential to be a training prototype in the future for new nurses in round and infection control. Within the informatics, I think we should like put computerized surveillance systems, and it will enhance the compliance monitoring and also put automatic reminders around it and washing hands may maximize adherence. But on a personal note, this project reaffirmed the significance of evidence-based practice. As a nurse, lifeline learning is integral to the provision of safe and high-quality care. This experience has further developed my skills in analyzing clinical issues, making interventions, and measuring the results. This has also further entrenched my realization that small adjustments in daily practice will yield dramatic improvements in patient safety. Through the application of such tenets, I am able to help foster safer healthcare environments throughout my entire career. And this is the end of my presentation, and I do thank you for taking your time to listen. Thank you.